Hello, everybody. Welcome to UNCG's Sustainability Lecture and Dialogue Series. I am Sean McInnes, UNCG's Sustainability Coordinator, and I welcome you all today for a great conversation with Love Odetola and Dr. Casey Workman. UNC Greensboro community has historical and contemporary relationships with Native American tribes, communities, parents, students, and alumni. We acknowledge that we are on the traditional territory of the Kiowa and Sora. In providing this acknowledgement, we also hope to bring awareness to the vibrant Indigenous communities whose members still call Greensboro home and are represented in the Guilford Native American Association and who are recognized by the state of North Carolina. These are the Kawari, the Eastern Band of Cherokee Indians, the Halawa Saponi, the Lumbee Tribe of North Carolina, the Meherrin, the Saponi, the Occaneechi Band of the Saponi Nation, and the Waccamaw Solona. And pardon me if I've mispronounced any of those. We honor and respect the many Indigenous peoples connected to the land where we gather today. And we advocate for a university level initiative in consultation with Indigenous students, faculty, staff, and communities to make space for Indigenous people by investigating ignorance and bias within the faculty, staff, and student body, recruiting and retaining Indigenous faculty, staff across all departments, creating safety nets for retaining Indigenous students, and developing coursework around language, decolonization, and land and water protection, which are culturally relevant and innovative in addressing issues of Indigenous sovereignty and environmental sustainability. If you would like to be involved in this initiative, we ask that you please contact evs@uncg.edu, and I will put that in the chat for you. Okay, on to the introductions of our guest speakers today. Dr. Cassandra Workman is an assistant professor in the Department of Anthropology at the University of North Carolina at Greensboro. She's interested in the biopsychosocial drivers and consequences of water insecurity, sanitation insecurity, and food insecurity. In order to understand these complex interactions, she engages in medical anthropology, environmental anthropology, and other disciplines such as human geography and public health. Current research includes an NSF-funded multi-disciplinary collaboration between UNCG, NC State, and Casey, is this Sokoine University Sokoine University of Agriculture, thank you, which will examine water insecurity, food insecurity, and infectious disease in Tanzania. Casey is presently leading a household level surveys concerning gender and sanitation access and decision-making in Ghana as part of a larger engineering technology project called the Commercial Partner Engagement. UNCG and NC State are working on an NGO-supported Ghanaian sanitation company, Sama, to implement sanitation technology to improve their business and more broadly to better understand challenges to gender equity in sanitation provisioning. And in addition to conducting scholarly research, she has worked in international development for donor organizations and implementing partners in Mozambique, Tanzania, and South Sudan. So lots to cover. I'm sure you're not going to be able to cover all of that today. And Love Odetola is a final year PhD student in the Department of Public Health Education. As a maternal and child health professional, she works to improve the health of mothers and children from a holistic perspective. Currently, her research interests focus on household level environmental exposures and maternal childhood health outcomes of African immigrants. Prior to the doctoral program, Love served as a consultant with the World Bank and recognizing that women are the backbone of climate smart agricultural initiatives. With that being said, I welcome you both. I welcome our guests, and Casey, I will pass it over to you.
Okay, thank you. Thank you for the introduction, and I really can't wait to hear the other presentation. I'm so excited to hear about child health. That seems like something that has emerged, every place I've been as something that's really important. So today I'm actually going to just focus on some of my current research. I'm going to present some data from a paper that I have under review right now, and also some ongoing collaborations and analyses I'm working on as part of this larger group that I'm a member of, a research network. So I'll go ahead and screen share and get my phone started, so I give myself the right amount of time here. Like at a conference, I'll give myself the big hook. Okay, so. All right, so today I'd like to talk about, I'll introduce anthropology and the anthropology's relevance to water insecurity, but also I'd like to talk about water insecurity and household water insecurity, particularly as a wicked problem. And what I mean by a wicked problem is, there's been no shortage of attempts to solve this problem. I think we all recognize the need for water. There's international recognition about the bare necessity of water and the bare minimum that people require in order to survive. But social scientists are currently thinking that maybe it's not just the bare minimum, that water is so entrenched in our social experiences as human beings and in our senses of justice and the meaning that's ascribed to water, that we have to think of water insecurity less about bare minimum and more about what is the kind of water we can have to thrive. So the definition of water insecurity, of which there are many, the one that I use is has been developed by a geographer, human geographer named Wendy Jepson and any number of colleagues. It's a large collaborative piece. And I won't read this to you, but basically she draws on, human capabilities and thinking, which basically says a few things. The first is that water is, you could think of water as a chemical compound, but water security is not just making sure that you have that compound. It's ensuring that there are the right social relations that allow you to access water, but access the kinds of water you want, the water volume you need, the water that's religiously important to you, the water that's preferred. So it has to be enjoyable to drink, and there's any number of ways that water has to be, that the parameters of water security have to be met. And the second important part about this definition is that it's about well-being in its full understanding. So not just having water so that you're not dehydrated or having water to grow your crops. It's having water so that, you're able to realize your full potential, however it is that you define that. I was a part of the development of a household water insecurity scale, and it's an experiential scale, which means it's subjective, so that you ask people their experiences, the frequency of experiences with several parameters surrounding water insecurity. And I was what was known as a site PI. So as we developed the scale, they implemented this, a battery actually included more than just the scale in over 8,000 households in 28 sites. And so it really was a global initiative. At the time, the scale that I used was 29 items, but it has since been shortened to 12 and then 4, which is actually important in some of my analyses coming up. But, Morogoro was the site that I implemented the battery in order to collect the data. So we pooled these data, which is within, anthropology, at least having 8,000 households is a huge sample size for us. And for those of us who are site PIs, we also collected qualitative data. I had lived in Morogoro, Tanzania at that point for about 7 years already. So I was also familiar with the water situation on the ground, just having lived there. So I have that perspective. I had also worked there in international development. So this is Morogoro. It's a city at the it's in the foothills of the Uluguru Mountains. And so it's about 4 or 5 hours inland from Dar es Salaam, which is the most well-recognized city. I sampled 300 households in 10 clusters using a random sampling method recommended by the WHO. In addition, I conducted 30 structured interviews. And as I mentioned, the scale at the time had 29 items. So Tanzania is a huge country geographically. I think, in contrast, it's massive compared to the state of North Carolina and even to our country. So I just wanted to give this, so you can see the picture. Morogoro was where I was working, is the little black dot. So this is just to give a little bit more context about the approval process. I was collaborating with my colleague, Kenneth Mapunda from the Sokoine University of Agriculture there. And so he and I were the team leads for the implementation of this battery. So because we pulled these data, we have been able to look globally at water security scores. So in a very recent publication, this one is actually under review, but my colleague Samir Shah, who's at the University of British Columbia, and I have been working on doing some analyses for Morogoro specifically. And so this histogram, if you look at it, you'll see that Morogoro is, you would think, relatively water secure, actually. So the mean for the water security score for HWISE 11, so that's using 11 of the items to calculate the score, is about 4. And so the max score out of 11 is 33. So to think 4 is actually pretty low comparatively, right? So it's low, it's low, but also it's low relatively speaking, right? And so this is actually we compared, across 26 sites. So it's not just that I'm comparing to a small number of sites, though I can actually say with some degree of certainty that Morogoro is fairly water secure. And here is from a different publication also using the HWISE data. And these were calculated by Justin Stoller and colleagues. And so I just wanted to show you, it's a little tiny, but you can see Morogoro, again, in comparison with the other sites, it's fairly water secure. And so you might be asking, how am I possibly talking in a panel about water insecurity about a site that's relatively water secure? But that wasn't my experience there at all. So while I was in Morogoro, I remember when you would have the announcements come by, the men in the pickup trucks would come by in the loudspeaker and they would say, "We have no water today." So, there was unexpected water cuts, and that was not infrequent. And, I learned then too that you have to have electricity and water at the same time, otherwise really bad things happen. And so even sometimes you had water, you had no electricity for any number of days, and so then you couldn't also access your water. But and then also the qualitative interviews don't suggest that people feel overall very water secure. So what's the discrepancy? Why is it that if you look at these tabulated scores for this metric, that you would think, oh, we don't even have to talk about Morogoro in terms of water? But I'll argue that we do. So in addition to the overall parent study that we were developing the scale, I also implemented this secondary assessment. And so in addition to asking about the frequency of certain water insecurity experiences, I asked about the difficulty. And so this was done because there's an argument methodologically that these scales don't weight the individual items. So for example, something could be infrequent, but really, really difficult. Or something can happen all the time and it's not very hard, right? And so it gets at whether or not these scales that are, about frequency, so it's Likert type. So in the last 30 days, of the last 3 days, how many times have you experienced X, And so we also implemented one where we asked people to tell us how hard the experience is. And so you can see the picture, right? Where we were just asking people, is it easier? Does it feel like a heavy burden to carry? And so this assessment was done in 150 of the total 300 that we had surveyed. So you'll see here, again, we have relatively low means, and these are out of 5. And so they're not all that high. So people there are some items that were very infrequently endorsed for frequency, and then, infrequently endorsed for difficulty as well. But what you'll see here is I've done a little bit of comparison for the ones that had the highest mean for frequency. So that's the things that happened in the last 30 days, and the highest means for difficult, which are those things that are understood to be subjectively difficult. And so obviously, people felt very angry about their water situation. And so why are they angry? If they're relatively water insecure, where is the anger coming from? And so you'll also see that there was a lot of water interruption, which I mentioned, and those could be unscheduled cuts, but they also are often put on a rationing schedule during the dry season so that people can only access the taps every few days. And so these are not free. It's actually water you purchase from the government. And so there are taps in the communities. The place that I was doing my work is, as I mentioned, called Morogoro Urban. And so I was specifically in one ward. It's a highly populated, highly dense ward. And there are a high number of taps, relatively speaking, too. So how is it that people are angry? Why are they having these water cuts? People were also, you see that they worry. So even, while you might look and the country as a whole is geographically very diverse, but Morogoro being where it was located by the mountains, actually there's less problems with drought and actually more problems with floods. And that has to do with the whole history of how the mountains are being utilized. But you still see that people are worrying. They're not able to access preferred water. And so they also worry about the safety of their water, especially when, the taps get cut. People were telling me that, if you don't get water for 2 days, you turn on the tap and it comes out brown, and they don't want to drink that. I mean, who would, right? Then you also see, though, in terms of difficulty, you do see some overlap. So you see that water interruption is very difficult. And so people are also, it's very difficult if you don't have the money. Water is a salable good. It's an economic good in this context. And so that can be incredibly difficult. And then again, you just see a lot of emotions, right? People are having emotions over this. They're angry, they're worried. So the qualitative findings really speak to this, I think, and it told me they were frustrated. And so this is a picture of the team that we went out to collect data. My colleague Kenneth actually took the picture, so he's not in it, but these are current undergraduate and master's students at Sokoine University of Agriculture. So this is actually fulfilling part of their degree requirements for field experience. And so I was really happy to be able to have this team out with us. And so to get back to the data, people were really frustrated. And what they were frustrated with was two things. They kept saying over and over again that the problems shouldn't be this bad. Right? So there's this sense of like, what's the problem here, right? Like we have these taps, we have this water system. The US government and several other international donors had just recently done this massive multi-million-dollar refurbishment of the dam and reservoir that provides the water here. And so people are just like, what's the problem? Like, why is this situation so bad? It shouldn't be this way. And so you see this quote from a participant who says, sincerely speaking, we have a big water challenge here. First of all, they ration water. It would be good if they repaired the water supply infrastructure. And so a lot of people also spoke to me about old and tired pipes and just, why is the system falling apart around them, basically? So my interpretation here is that we saw the strongest association for variables associated with, the body and hygiene. So obviously people want water to be clean. And this was specifically, people were frustrated when the water was cut that they couldn't do their laundry, right? They couldn't take a bath. And to me, that really just speaks to human decency, right? Like that people don't want to feel ashamed because they can't be clean. They want to be able to not have to rearrange their entire day to do laundry, particularly for folks who work outside of the home and have uniforms that they have to wash. They were also felt really impacted socially. And so people were telling me I had to rearrange my day. I couldn't do this thing I wanted because the water got cut or there wasn't enough water. So now I had to go and ask my neighbor if I could borrow water, and I couldn't attend this social event. And so it's really, they were talking a lot about how they had to rearrange their days. And, if you think about it, if you look at the policy documents or if you look at a lot of the literature, it's like people have to have enough water to drink, right? We have to provide this certain bare minimum number of liters a day so that people can survive. Well, people also want enough water to do their laundry at the time that's most convenient. And so you might think that, okay, maybe that's not as difficult as, say, going to bed thirsty. But if this happens to you over and over and over again, it creates a real sense of frustration and also just impact to your daily life. And so you can look and think, yeah, sure, like if a water cut happens once in a season, not a big impact. But when you start having water cuts that are happening every week and they're unexpected, and you actually think you're going to have water and you turn on the tap and there's none, that's a huge inconvenience. So of all of the variables, the highest degree of overlap between the ones that were frequent and also difficult, anger really emerged. It really rose to the top. So people are frustrated. So obviously, being unable to bathe and change your plans was not as frequent, but nonetheless was bothersome, right? And so I think that these are the kinds of things that you might not think of when you think of water security, like the fact that you have to, and the impact on children, obviously. So I'm looking forward to hearing more about that in a moment, not just for their health, but kids who can't go to school, maybe because they have to, go and fetch water, and maybe they'll get to school eventually, but they'll be late. And so there's also those impacts. And so, this, I think, really underscores the social science perspective that there's real psycho-emotional and psychosocial effects associated with water insecurity. So it's not just the fact that you need safe water that's free of pathogens to prevent infectious diseases, which I don't disagree with, or the fact that you need water for, your body to maintain homeostasis, or that you need water to grow your crops, because those are all certainly true. But you also need not to wake up feeling frustrated and worried and angry every day. And so at the end of the day, we can think about, well, why is this wicked? And so, as I mentioned, and was said in the introduction, that diseases are what we call biosocial, right? So if you think of, and I mean illnesses too, and diseases tend to be those things that have biomedical understanding. So, viruses, bacteria, diseases, we can think of as being a little bit more narrow than the anthropological or human geographical understanding of illness, right? And that's the total body experience. So there might not be a biomedical correlate for the fact that someone is experiencing something negative in their world. And so, you could think of diseases and illnesses as biosocial. So yes, they, on the one hand, they're biological, but you also have, the social relations that result in it. So why is it that you tend to see the correlation between poverty and ill health? That's social. Those are social relations that are allowing illnesses and diseases to proliferate. There's also gender relations at play too. Who is responsible for what will impact how water is needed and how water is used. And, there's also risks, gendered risks. So you'll see that women are also often can get sick during food preparation, and men can get sick when they're out working in the fields. And I'm not trying to make any kind of stereotypes about gender roles here, but I'm just saying that risks are gendered. And there's risks to both men and women depending on where they work. And all of this is dependent on power relations, right? So why is it that in some places people don't have water every single day or have it all day? Why don't they have the power to make those kinds of requests? And so water insecurity drives both psycho-emotional and biological outcomes, I think is really why this is a wicked problem. And so, you know, I'm thinking of South Africa, for example. What they did was they took very seriously the recommendation that people have a bare minimum allotment of water per month based on the recommendations of the World Health Organization, among others. And they recognized water as a human right. So what they said was every month we will give people this amount of water. Well, it turns out that that wasn't enough. And so people, used that water very quickly and then had to go without. So the bare minimum is not what we think, and I don't think it's the solution. And so at the end of the day, water insecurity is not just about water as a resource to marshal. So it's not just about fetching your water and having the water that you need for your daily needs. It's also about perceptions of unmet need, right? So what else do you need water for that you're not getting it for? You know, um, inequality and injustice are incredibly important. So why is it, that you look around and you're like, well, that person has all the water they need and I don't? Like, well, why not? And you see that here in the US a lot too, is real senses of injustice when it comes to water and inequality. Like, well, how come that neighborhood has the good water, right? Like, why is their water cleaner? You see in the US, disproportionate burden of the purchasing of bottled water in communities of color because their water is, either objectively bad or there's subjective distrust of the government, right? For good reasons. And so this isn't just a global South specific problem too. I'm trying to say that these are experiences that are felt all over in low income, middle income, high income countries as well. And so, at the end of the day, water is more than material. Yes, water is a chemical compound, right? It's H2O, but it's also about the social relations around it. It's about how water is meaningful. Water has a lot of importance. And the fact that water is something that you can feel injustice about is really important. And it really just, I think, speaks to the cultural importance and social importance of water as well. And so I'll end there. And so I'd like to say thank you. And if anyone has any questions, I think I'll hand this over now and answer any questions as they come. So let me end my screen share.
Thanks, Casey. Yeah,
Sure.
I didn't think to say it earlier, but we'll just take Q&A at the end for everybody so that we have time for Love to give her presentation. So, but if you do have, if you're thinking of a question, make sure you put it in the chat so you don't forget. All right, Love, we're handing it over to you now.
Thank you, Sheen. And thank you, Dr. Workman. That was awesome. Since I mean, I'm an African immigrant as well. So hearing some of those issues, I was like, oh, thank you for validating our experiences. So thank you for that. That was very awesome. And I definitely look forward to the Q&A session. Of course, I'm honored to co-present with Dr. Workman, and I'm grateful for the invitation to this platform. And as she was rounding up, as Dr. Workman was rounding up, she mentioned how these experiences are all over, right? It's not just exclusive to the Global South. And this study, or what we'll be talking about for this section of our time together, will focus on a community here in the US. And so it would be interesting to have both of those perspectives and see how we can move on from there. So I'm actually going to start with some background on what's I'll be touching on today. This is in the city of High Point. That's right across, it's not far from Greensboro, city of High Point here in North Carolina. And this study specifically was completed in partnership with the Center for Housing and Community Studies with Dr. Stephen Sales there. And I believe it was during a meeting, perhaps with stakeholders, that members of the Department of Health in High Point had shared that there was a concern with high blood lead levels in children in some neighborhoods in High Point. And I believe they had looked at some other sources, including paint, to see, is it coming from paint? Water was a source that they hadn't yet explored. And we're going to briefly talk about why water is even, why lead in itself, being exposed to lead, is such an important issue to address. So I don't know if I introduced myself. My name is Love, and I think she did a good job with the introduction. So I don't think I need to go into my background in detail. But I am a final year PhD student here at UNCG, and my advisor, Dr. Morrison, she's online. So thank you for being here as well. Now, when we talk about, before I go into what lead is about, this is just a brief overview of what we're talking about. We're talking about lead and its interaction with our health outcomes. And then I'll touch on the pilot research study, the pilot study that we did. And then I'll provide some further contextual factors that would be important to consider as we talk about this issue, and then some implications. So this is for those who prefer a visual aid. This is a picture of a worker who's holding a lead pipe, an actual lead pipe. But this is in Minnesota. This is not in North Carolina, but it's just to give us an understanding of what we're talking about here. So there was some concern there in that state about lead piping, and so they'd gone about pulling these out. And this is kind of what an older pipe looks like. So when we talk about lead and human health, right, all across the life course, so from in utero all the way up to adulthood, lead can impact our health, right? So when we talk about in utero, the placenta often is seen as a barrier for the developing fetus. It protects the developing fetus, protects the child from various contaminants, from exposures. However, lead is an exception to that, in that lead actually crosses the placenta. And the interesting thing is that when a woman is, if a woman was exposed to lead prior to that pregnancy, lead often gets stored in the bones, and during pregnancy, it's released, right? So it's released, and it travels, and it could cross the placental barrier and affect child health outcomes or pregnancy outcomes, I would say. Moving on to when the child is growing, child is born, growing and developing. If the child continues to be exposed to lead, it actually affects their nervous system. And unfortunately, there's no amount of lead that's known to be safe. We've noticed or noted negative health outcomes even with very minimal exposure to lead. That's below what we originally thought was okay. Exposure to lead affects IQ levels. It affects behavior. You end up seeing a child growing and being a bit more aggressive than normal, and maybe even getting in trouble with the law as they grow up. So there's also that aspect of the impact of lead on health outcomes. And even in adulthood, if as adults we're exposed to lead in water and via other sources, there's a higher risk of high blood pressure, of heart disease, and even reduced fertility. So you can see why the Department of Health was concerned. You could see why having high blood lead levels, especially among children, is of concern, because when you talk about the brain development or nervous system developing and that being affected, it's actually irreversible. So once the child begins to experience some of these outcomes or some of these the repercussions of exposure to lead, it's unfortunately, and it begins to affect their IQ levels, their developing brain, it's irreversible. So again, that just gives us an understanding why the health department would be concerned about this. And so we sought to, really had two questions. One was methodological in nature, and we wanted to know, let me give it. One was methodological, and then the other one was more to see if there really are violations at the household level. The reason why I'm talking about the household level is because in a city like High Point, at the community water treatment center, or the community water treatment plant, lead has been taken care of, right? So by the time it gets to the home, it's already been taken care of. It's gone through the piping system. By the time it gets to the home, there's still a chance of lead actually being present in the water once the resident turns on their tap. And the reason for this is because for example, if a home was built, let's say the 1970s or so, early 1980s, late 1970s, or before that time, there's a much higher chance of that home having lead piping within the home. Maybe even unmaintained fixtures. So you see where you think that's taken care of at the community level. By the time it gets to the household, other factors may have come in, and then a child, a mother, a resident may be exposed to lead outcomes. So we wanted to know, at the household level, how can we test water within? When we talk about privacy issues, you talk about, okay, are they going to open up your homes? Are they, what would be an effective data collection method to test for lead in water at the household level? And then we wanted to see, okay, is water actually a source of this issue that we're seeing among children? So it was twofold. Now, we went about this, when we talk about the specific methods, we first engaged in geographical information system mapping, and this was to identify neighborhoods or parts of High Point that have older homes, as well as parts of High Point that are poorer. And as Dr. Workman mentioned earlier on, unfortunately, neighborhoods, communities that are low income have a higher chance of having some of these contaminants in their system. So we engage in GIS mapping, and I think this is just an example of a map here where shows poverty levels. The darker the color, the more prevalent poverty is. So after that, once we identify the neighborhoods, we then began, or the neighborhood we're going to work in, we then began working with community members, community leaders. We went to neighborhood association meetings, proposed the project, got feedback, them tell, oh, this might not work, how about you try this? And getting their backing on this project. And then we proceeded with water testing as well as education. The community members were really, especially the community leaders, were really instrumental in refining this project. So just to give us an idea of the community we're talking about here, it was a minority dense group. If you see here, over 75% of the population was either Black or Hispanic. And when you compare it to the city of High Point, broadly speaking, there is a difference, right? Thinking of household income, the median household income within this specific neighborhood, especially within the block group, it was less than $20,000 for the household income compared to over $60,000 at the city level. And again, most of the homes were built in the 70s. And this was actually in the early 70s compared to 1986, which is the median year built for the city at large. So it was definitely a poorer neighborhood, minority dense, as well as with older homes. So how did we go about this? First, we worked with the community leaders, and we went to community events, and we had test kits. Right, so we had educational material. If you do have lead in your water, this is who you should contact. This is what you can do in the meantime. We had all that in the packet, as well as the test kits, the strips that we used to test. And we would provide these to residents, and then they could either they could go home on their own time, test their water, and then submit it either in person or online. So there were both options. In person, we partnered up with a local community organization right there within the neighborhood, so they could go on over and submit it in person, or they could just submit it online. And again, we expected them to do this on their own time, right? That's really important, on their own time, to go and test their water and send the results to us. Needless to say, this did not quite work out. Let's say we give out 100 test kits at a community event. Less than 10 of them came back to us. That's less than 10 results. So you think about over 90 test kits going to waste. It's not helpful for the research team. It's not helpful for the community members. It was just a waste. And this was over a period of 2 months, us just sitting, waiting, calling, texting, and say, oh yeah, I'll get it done. I'll get it to you. Yeah, didn't really quite happen. And so we had to pivot. We had to implement some changes. And Dr. Sills recommended that we would go from home to home, knocking on doors, presenting the project, and then testing at the door, as well as providing educational material at the door, one-on-one. And with this response rate, it bumped up to over 90% over a period of 1.5 months. So almost every door we knocked at, the family member, whoever opened up the door, if it was 2-3 people, oh yeah, we'll provide the sample. And I think what helped here was that we did have some media coverage, and they had seen us at community events. So they knew us. They knew our bright yellow t-shirts. So as we went from door to door, it was easier to collect the data and to test on the spot, as well as provide a filter and provide some educational material and resources on next steps. Now, going into the results, remember, if you may recall, one of the goals was to see which of these, like what method would work. How can we collect data? How can we collect data on lead or even contaminants in water effectively and cost effectively as well? We saw that going from door to door was a lot more effective than expected the results to come back. And even we were actually, it was interesting because we were able to get some contextual information. Again, I refer back to what Dr. Workman was saying. So residents would say, yeah, I don't drink that water, girl. What? No, it smells funny. It tastes nasty. So we're able to get some of that feedback. We would not have gotten those if we had just waited and expected the results to come to us and they fill out the form and all that. So we're able to get some contextual information that was that ensured richer data and richer understanding of what was going on. Now, as far as the test itself, testing for lead, we tested at least 70 homes, and about 1 in 4 of those homes had some amount of lead in the water. Actually, it's more than 1 in 4 had some amount of lead in the water. This is of concern. What I will say is that we did use Dipsticks, and I'm going to touch on that briefly later as to how that may have affected the results. However, it wasn't we didn't lab test, right? It was Dipsticks. Nonetheless, it is still of concern that 1 in 4 homes showed some amount of lead in the water. Now, what I didn't mention was in addition to lead, we tested for 13 other contaminants and characteristics of so hardness of water, acidity. Chromium was one of those that we looked at. We also looked at various other contaminants, or various other contaminants. Now, chromium was not on our radar. We just this was a pilot study. The goal was to get some preliminary data and then apply for funding to explore this issue more, right? So chromium was not in our radar. That was not something we even thought about. And if you see here, let me see if my arrow is working. Okay, so over 50%, so 1 in 2 homes, every other home had high levels of chromium in their water. Now, this was quite surprising. This really was quite surprising. Chromium was more prevalent than lead in the water. Again, I just want to reemphasize that this project was with Dipsticks. It was a pilot study, so none of it was lab confirmed. It just gave us some idea of what may be going on so we can move on and then get funding to have a broader and a bigger project. Unfortunately, that was right before COVID happened. I think I wrapped this up like January, February. By March, we were out of school. We couldn't even, I mean, talking about going from door to door knocking, we were on lockdown by that time, I think, at least ramping up to that. So this was put on hold at that point in time. Now, I do want to touch on, I'm talking about lead, talking about chromium that may be present in water. I do want to give a bit of context here. As someone who is in public health, we talk about social determinants of health. As we talk about health outcomes, when we look at this community, when we look at the block group in which they're situated, this community actually lacks ready access to healthy food sources nearby. In fact, about 27% of the households don't even have a vehicle to drive to grocery stores. And then it's not surprising that we see high rates of type 2 diabetes. It actually has the highest rates of type 2 diabetes, of heart disease, compared to other parts of the city. I believe either the city or the county. When we think about the county at large, so that's Guilford County at large, the mortality dying from a disease such as diabetes is even 3 times the average of Guilford County. So really thinking about this community, there are other issues going on, right? The other issues going on. It has the highest rate of mortality from cancer, heart disease, stroke, and broadly speaking, the lowest life expectancy in the city of High Point specifically. So within the city, there are disparities. Within the county, there are disparities. So when I see this, I just, as a budding researcher, as a student, I begin to wonder it seems that there's more than just water. There's more than just, there's chromium in your water, there's lead in your water. And it just kind of pushes me to think beyond just environmental remediation. Yes, it's important that we pull out these lead pipes. Yes, it's important that we provide filters if that's the solution that's needed in the meantime. That's before maybe the pipes are pulled out, before we engage in further research as to what may be going on. All the environmental remediation is crucial. Of course it is. Now, I'm pushed to think beyond just that. When I see all these other health issues going on, I see all these other social determinants of health popping up, and I wonder if there's a way to look beyond just the environmental remediation and consider some of these other issues that may be going on so that indeed we may have sustainable solutions. And even as a researcher, as professionals on the call as well, just thinking about adopting principles of environmental justice. As was mentioned earlier, there's no reason why we should, regardless of socioeconomic status, regardless of ethnicity, regardless of geographical location, we should not be exposed to such items in our water. We should have the right to portable water, to clean water. The last thing I do want to mention here is, even as we talk about the health issues, as we talk about the exposures to contaminants via water, I do want to, the community that we worked with, just the leadership platform, how connected they were, it really is an asset. So even as we think about possible ways of solutions or moving forward, ensuring that community members are the core of anything that we address. And of course, I want to thank the community members for opening up their door to us, for being so generous with your time and kind. I would want to end with a thank you to them as well as the community leaders. And with that, I will end and ask if you have any questions or even comments or thoughts. I'll be happy to hear those as well.
Thank you, Love. Great presentation, very insightful. Really appreciate it. I invite everybody to unmute and turn your cameras on if you like to do that, and we're going to open it up for Q&A. So please don't be shy. Well, you have a question in the chat. How would people in this group go about testing their water at their house if they wanted to do that?
Yes, The ones, so the test kits that we used, very inexpensive. I think I got 100 strips for about $20. So very inexpensive. Now, if you do want to test it officially, there is an organization that you can send it to, and you just pay for shipping and handling, I think. It took, I think, about a week for them to get some results back to me, and they'll lab test it officially and get the results to you. So there's that as well. I will look up the organization and post it in the chat.
Thank you.
Briefly.
Does anybody else have any other questions for our presenters today? Okay, Love, you had a question.
Yeah, I'm curious. So in Tanzania, were the students the one who translated? How did you deal with communication and ensuring that what they shared during the interviews and all that was
Okay, that's a good question. So the surveys were translated by my colleague Kenneth into Swahili, and so the surveys that were enumerated by the team were actually there was only, I think, of like 3 open-ended questions in the whole assessment. And so everything else was pretty straightforward and quantifiable. And then the interviews Kenneth and I did, and so I speak Swahili, but my listening comprehension far exceeds my speaking. So we always did them as a team. And also because of all of the technical words, I had to learn, we also had a sanitation component. And so I had to learn all the different phrases, and there was just a lot of, I think to me, the challenge was words can mean so many multiple things. So like the environment, depending on the context of the sentence, could actually mean your latrine or like your garden. And so like, you know, because it's just like when, or the word area, like, and so I really felt like I needed a native speaker with me. And so, and then together we, you know, he did the transcription. And so I have the Swahili and English interviews. I have them transcribed in English and Swahili is what I'm trying to say. So.
Awesome.
Yeah.
Great. Okay. We're just about out of time. I mean, we're always happy to extend it, but we want to respect everybody's schedules and everything. So last call for questions from our remaining guests. Okay. Well, I thank you all for joining us. Casey and Love, thank you both so much for your participation in this event. We really appreciate it. Learned a lot today. That's it for today. Thank you all so much. And again, thank you for joining us, and I hope you have a good day.